wild.
And it recent case of the actor Christopher Reeve can't even breathe without assistance. Now, this was the plight of one young woman until a British medical team gave her a new lease of life. And here's how they did it. Each year, road accidents in Britain claim the lives of more than 3,500 people. Another 300,000 are maimed and injured. Tragically, one of the most common injuries is a broken neck. When that happens, it's not just paralysis that many victims face.
When someone breaks the neck and also has a spinal cord injury, most people don't recognize that quite apart from the paralysis, they also lose the ability to breathe. This is mainly because most of us take breathing for granted. It is something which the body does on its own.
Indeed, we do it automatically. How? Well, first, special sensors in the brain send messages down the spinal cord to the phrenic nerves, which are attached to the diaphragm. The nerves stimulate the diaphragm, making it flatten. This causes the chest cavity to expand, enabling the lungs to inflate and deflate.
But when a break occurs in the neck or spinal cord, the messages can no longer get through and breathing becomes impossible. In the past, the only way many patients could survive was in an iron lung or connected by plastic tubes to a ventilator. In either case, they had to rely on a mechanical breathing system. But now, there is another way.
Right, so what
Meet Christine Leung. 6 years ago, after a car accident, it looked as though she would be confined to a bed and a breathing system. But now she's studying to be a lawyer at the University of Central England. How? With the help of a unique technology called the Phrenic implant or stimulator.
The biggest advantage of breathing with a Phrenic stimulator is that it is an immeasurably more natural mode of breathing. There are no tubes connecting your neck with the ventilator machine, but most important of all, it is the regaining and the restoration of the quality of life and the ability to be moving around wherever you want to go.
Being able to enjoy a normal life, to go out and meet friends, has transformed Christine's life. But how does the implant work? Nerves normally respond to electrical pulses from the brain. The Phrenic implant sends artificial electrical pulses, fooling the phrenic nerve and making it flatten the diaphragm as in normal breathing. But it will only work if the nerve itself is undamaged and able to respond to the electrical pulse. So they test to see if the nerves work by using a magnetic stimulator. It fires magnetic waves through a loop placed over the phrenic nerve. If the nerve is intact, it's stimulated and it makes the diaphragm move. And that movement is registered on monitoring equipment. Once it's clear that the nerve is intact, the implant is inserted in a 2-hour operation.
The phrenic nerve implantation is a major surgical operation, and we start by having a vertical cut on the breastbone, which allows us to expose the heart, and the phrenic nerve runs on either side of the heart. To stimulate those fibers, we attach 2 small electrodes on the side of the heart where the phrenic nerve is at its thickest. They are then connected to a small radio receiver pad through the chest wall, placed under the skin.
A rubber antenna is then placed over the skin. The antenna passes on radio signals to the receiver from a transmitter that the patient carries at all times. The rate of breathing is controlled by settings on the transmitter, and when Christine calls for her regular checkup, the settings can be adjusted by this machine. So what's her verdict on this pocket miracle?
The breathing implant have changed my life in many ways. It have given me greater mobility so that I can go out far more, able to attend university every day, and certainly make the quality of my life much better now.
Now, some people fancy making money the easy way, like in the casino.